Hi guys, once again Ijaz Hidayat is with you with new talk and with new discussion. Today again we have the second session of question and answer. Today there is a question that, as you know, to establish cardiopulmonary bypass with the help of heart-lung machines, of course you need to heparinize the patients, and after heparinizing the patient you have to confirm the bleeding point of the blood. So of course we needed, as you know, that the ACT level, the normal ACT level is around 120 plus 10 and plus minus 10 and 20, like a 120 to 130 40 is the normal range of the ACT. But after giving the anticoagulant to the patient prior to cannulate the patients, of course we need to give a huge big bolus of heparin, and then we do one test called the ACT, activated clotting timer, which tell us the bleeding point of the blood, and then which allow us to cannulate the patients to establish cardiopulmonary bypass. The question is this, that in case after giving a big bolus of, as per your hospital policy, if you give a big bolus of the heparin prior to the cannulation to the patient, and you check prior to the heparin, you check the baseline is right 140 seconds. Then heparin given by anesthesia, and after giving the heparin and after 3-4 minutes of heparin given, you get a blood sample from anesthesia, which is drawn by the anesthetist, and they are given to you to check the ACT level. So when you check the ACT level, and if your ACT is after giving heparin is like 280 seconds or 300 seconds, what can be the causes? So the answer for this, that if ACT is not achieving the goal which we required, like as we know that we required more than 400 seconds of the ACT prior to cannulate the patient, prior to go on a bypass. So if your ACT is not achieving more than 400 seconds, what can be the reason, what can be the causes? So number one, you have to check your the ACT vial, maybe your AC, the medication you take while drawn from the ampule was expired. Number two, maybe the time of you inject the bolus of heparin or anticoagulant, it should not going into the systemic to the patient. No, it was not a correct route. Maybe it was drawn back into the table because maybe the 3-valve is open. Number three, you need to check your the ACT machine's calibrations. It's maybe your machine is malfunctioning. Or number four, maybe the amount which you have given to the patient is not adequate. Maybe you require more heparin, like normally we are using 300 to 400 units per kilogram to the, as per the hospital policy, to the patient. So now, so you checked patients' medications like heparin, vial was perfect, dose was perfect, the route was perfect, the machine's calibration is perfect, your ACT cartridge expiry is perfect. But if still your ACT is not improving, although you give an additional dose of heparin, and still your ACT is reaching to around like 300 seconds, and you repeated the heparin dose, but still the ACT level is not increasing, what can be the cause? So the cause can be, maybe there is a deficiency of the antithrombin 3 factor in the blood, and in this type of scenarios, in this type of situations, you can add 2 points of the FFP, fresh frozen plasma units. So in a fresh frozen plasma unit you will find the factor antithrombin 3. So by adding, maybe there is a deficiency of the antithrombin 3 factor in the blood of the patient's blood. This can be the reason that your ACT level is not increasing. So if your ACT machine is fine, ACT cartridge is fine, your heparin dose is fine, even you repeated the heparin dose, still your ACT is not achieving to the mark, like it's not achieving more than 400 seconds. So the last work which you have to do is you can give 2 units of FFP, fresh frozen plasma units, and then repeat the ACT, and you will see your ACT level will increase, because by adding more the factor 3 anti-inflammatory factor into the patient's blood, so it will automatically increase your ACT level. Guys, hope today's question you understand and enjoy. Have a nice and good day. Take care.